Welcome back. The Nigerian Association of Resident Doctors, NARD, has issued a 4-week ultimatum to the federal government over a series of unmet demands, some of which date back over a decade.
From unpaid salary arrears to the exclusion from specialist allowances, the doctors say they've had enough. And if the government doesn't act, we could be looking at another nationwide strike at their May general meeting in Uyo, the Akwa Ibom state capital. NARD acknowledged some progress, like disbursement of the 2025 Medical Residency Training Fund, but they also expressed deep frustration over persistent issues. Now, join us this morning for this discussion is the President of the National Association of Resident Doctors, the President Nigerian Association of Resident Doctors, Dr. Odubakun Kazim. Good morning, Dr. Kazim, and thanks for joining us on Breakfast Central.
Good morning. The name is actually Dr. Osundara Tope. Dr. Kazim is my secretary.
Dr. Osundara Tope, thank you so much for joining us this morning. Please, could you kindly give us an overview of some of the pressing issues that the authorities are yet to address that prompted this ultimatum? What are your biggest grievances?
Thank you once again, and good morning to you at the studio and to listeners all over the world. We expect a responsive healthcare system that is ready to, retain skilled health workers in Nigeria. But unfortunately, some of the concerns from NARD that would ensure that this is facilitated and done has not been implemented, and it is giving us so much concern. And to avert any imminent peril that could bedevil our healthcare system, that is why NARD, the Nigerian Association of Resident Doctors, has cried out, and during our last meeting in New York, just like you mentioned, there is a 4-week window that was given to the Nigerian government, and especially to the parent ministry, that's the Ministry of Health, to look into these matters that concerns human resources for health, because you cannot take away the human resources for health, the material resources for health, the financial resources for health that would retain our healthcare workers in the system. And as part of these human resources for health is the career progression and career development. And there is an undertaking from the Nigerian government to fund this human resources for health through the Medical Residency Training Fund. And for 2025, we've not been able to get this Medical Residency Training Fund. And you agree with me that Nigeria at this time needs specialized care, especially for those who are suffering from one form of ailment or the other. And unfortunately, what will improve on the skills of doctors in Nigeria has not been adequately funded by the government. Another thing is specialist allowance. Government should also understand that adequate and commensurate compensation should be given to those who are working. Specialized care, which we are rendering, there should be a compensation for it. And unfortunately, this specialist allowance has not been paid to the Nigerian doctors under the Nigerian Association of Resident Doctors. We also have the use of several areas. The 2023, 35% performance arrears has not been paid. Accoutrement allowance has not been paid. We also have issues of local doctors scattered all over the country who are not also receiving adequate compensation and regularization of their appointment, and several other issues that we've tabled before them. And none of these things has been addressed as of now. And to avert what may be, industrial disarmament, we've been calling on them, and we are using this opportunity again to call on well-meaning Nigerians to, accede to our cry and concerns and talk to those who are in the corridor of power to ensure that these concerns are taken care of.
All right. But what is taking, why is it taking so long a time? Why is it that currently, as we speak, there hasn't been any adjustment on the salaries of doctors to actually at least meet with the current pressing times that we live in? Why is it taking so long?
And what's the government's response to all your grievances and these things you mentioned earlier?
The ministry, the parent ministry, Ministry of Health, has been forthcoming with relating with us, but execution of whatsoever agreement that is on the table is with the other ministries like Ministry of Finance, Ministry of Labor, and the presidency itself. Unfortunately, nothing has been forthcoming from all these other agencies and ministries under the Nigerian government. But the Ministry of Health has been at least somewhat responsive, but they lack the capacity to execute whatsoever agreement that is on the table, because payments cannot be done by the Ministry of Health. It can only be facilitated either through the Accountant General or through the Ministry of Finance, or maybe presidency giving an express order. And I'm aware that the presidency is also in the know of some of these agitations, but we are just, taken aback, bemused as to the sluggishness or the lukewarm attitude from the other agencies of the government who are also key stakeholders in the health sector. So the response from government, so to speak, has been very lukewarm and shallow, and this is unacceptable to us. Whatsoever is causing them this delay, we cannot tell, but like if you look at the policies, from the Ministry of Health through the Honorable Coordinating Minister of Health that was released some time ago, maybe about 6-7 months ago, on health workforce migration. And you will see as part of the thematic areas that government needs to fund, human resources for health through career development, like I mentioned, and through incentives. And incentives must be adequate to retain your doctors and other skilled health workers in the system. Incentives must be commensurate, it must be adequate, it must also be competitive, so that it is out of this competition people will now begin to draw attractions to your own system of how you take care of your own health workers. So that, and unfortunately too, Nigeria happens to be one of the highest exporters of skilled health workers in the whole of Africa. We are the highest. And what has the government done to avert and to mitigate against some of these things? The response to these challenges has been suboptimal, and it is another wake-up call to the government to ensure that we retain our doctors, we retain other skilled health workers in the system through better incentives and adequate welfare package for skilled health workers.
Now, Dr. Osundara Tope, what happens after this 4-week ultimatum elapses? And if the government can do at least 2 or 1 out of your demands, would you still go take industrial action? What are your expectations?
Well, as of now, there is nothing on the table. It is when they bring something to the table that is when we can consider maybe some of their actions and inactions. But as I'm speaking with you now, there is absolutely nothing on the table from the government that we can even consider that, okay, this is what they are going to do within this time frame. And to avert the imminent peril of industrial disharmony or breakdown of services rendered to the Nigerian people, that is why we are using every means possible through dialogue. We've done dialogue, but like I've been told, that the Nigerian government doesn't respond to dialogue, and what they want is you go all out against them, strike. And we believe that if they can give us something, maybe we can reconsider. But if within this time frame of 4 weeks, which we aspire next week Tuesday, if there is nothing on the table, I'm not too sure that we will be able to, continue to render our services to the Nigerian people.
But what is the cost of going on strike now on Nigerians, especially also looking at the fact that our healthcare system is grappling with a lot of challenges in terms of doctors to patients? Should there be another strike now? What is the implication?
Well, the implication is just that the very fragile healthcare system that we have in Nigeria will thin out. And another thing that will happen is patients, for instance, you have the recent senseless killing happened in Benue, and you have a whole lot of people who are under the care of doctors and other health workers in Benue State, especially Benue State Teaching Hospital. If we withdraw services from this kind of area, people will suffer. There will be deterioration in the already very weak healthcare system, and people who are under the care of doctors and nurses will not be able to get this adequate care. So eventually, mortality, morbidity will be on the rise, and this is why we say that we don't want all of these things to happen, and government should accede to these concerns and demand. It is not our pleasure. We don't derive any pleasure in seeing Nigerians, seeing people who are in the hospital die or suffer or unattended to, and they begin to have more complications with their, health. And out-of-pocket payments will also increase because you cannot compare the services that you get in a teaching hospital or any other tertiary institution owned by the government to what you are going to get in a private sector. If you go to a private sector, under this very hard economy, you still go to a private sector to seek health care. It's going to increase what you are going to pay out of pocket payment to be increased, and it will also affect universal health care coverage. In other words, doctors who are supposed to go to the very underserved environment will not be able to go there because we are going to withdraw all of them from the system when any of this happens, when we go on industrial disarmament. So these are part of the implications or consequences of down-tooling or industrial disarmament.
Now, you mentioned earlier during our conversation that your parent ministry, the Ministry of Health, it's been forthcoming. They understand the issues at hand and your demands, but they just don't have the means to execute or disperse payment, which you said the power lies with the budgeting office, the Ministry of Finance, and also the presidency. So my question is, why don't you direct your grievances to the presidency, perhaps, and to those who can expedite and make sure that your demands are ahead rather than the Ministry of Health? Go and lobby with those in the budget, finance, and of course the presidency, so they see the urgency and the importance of some of this demands. The National Association of Resident, the Nigerian Association of Resident Doctors are making.
All right, thank you for that question. I can assure you that all of these things that you mentioned has been done. In fact, one of the reasons why we've not been able to proceed on industrial disharmony is because the Nigerian Medical Association, who is also our parents or the mother body for the association, has also waded in. So we've involved virtually all the stakeholders, prominent people in the society. We've called their attention to it so that we can mitigate against the impending peril. And we've done all of these things, met with Accountant General, several other people within the Ministry of Finance. We've seen, the top, government officials within the Ministry of Finance. They are already in the know. The only problem they have is that they lack the power to execute because probably they don't see it as priority. That's just the problem. They cannot tell us money is the problem. There are so many things they use money for, but when you are not on their priority list, so they just treat you shabbily. Then you make doctors and other health workers feel like they are cog in the system. Like they are immaterial. Like they don't matter. in the scheme of things. And that feeling makes you a little bit, sullen and sulky, and you now begin to look at why is this happening to us as doctors and health workers within the system who are giving their best, the optimum best to ensure that we keep body and soul of people in this country alive. So it's just unfortunate. We've mention those people in the corridor of power. Within this Nigerian system, we've met with all of them. We've had dialogue, we've lobbied, we've appealed, we've done several other things that even it's not even worthy of me to be speaking of on here. Several things we've done just to ensure that we avert whatsoever is happening. But it's like the government is turning deaf ears to our cry, and they are calling our bluff. Whatsoever you want to do, go and do it. So nobody within the populace or the public should see the Nigerian Association of Resident Doctors as being, nonchalant to the healthcare needs, or maybe, not responsive to, and we lack empathy to the Nigerian people. No, that is not it. We've done our own bit, we've done our own best, but it is unfortunate that the government is not, giving us the reciprocal attention that we seek from them.
All right. My question would be, I do recall that the president had extended the retirement age for doctors from 60 to 65 years. I would like to get an overview on this one. How has it impacted the health sector? And secondly, with these demands, can you state them categorically so that we can get clarity on what your demands truly are? Maybe 1, 2, 3, or are they more than 3, and so on? So I'd like you to react to the two questions.
All right. So let me start from the rear. So the demands are, the 2025, that's 2025 Medical Residency Training Fund, which is on the table of the Minister of Finance, which is yet unattended to. Then we also have the issue of areas of 25-35% promise for health workers in Nigeria. So it's a 7-month area that has yet to be paid. Then we have issues of accoutrement allowance areas. We have issues of specialist allowance to doctors. Then we have another problem of, inappropriate regularization and compensation for local doctors. So it is casualization of health workers, which we do not agree to. We are not, comfortable with casualizing health workers in Nigeria. And it is, these are things we've tabled before government. We also have the issue of consequential adjustment of the minimum wage on our commerce salary structure. This has also been tabled before government, and nothing has been done to it. Then lastly, we have issues of the OUTH, the welfare concerns of members in Obafemi Awolowo University and Hospital Complex is not something to write home about. And we've called on Ministry of Health and other stakeholders, including the CMD of this facility, to ensure that the welfare of our members in that center and in every other center across Nigeria is well and adequately taken care of. So for the retirement age, well, I think it's just, another alternative or another means of retaining doctors and our skilled workers within the system, because we have limited number of skilled workers among doctors in Nigeria. So if we find any of these elderly doctors in their 60s and 70s who are still agile and can still work, I think it's a stopgap. It will be able to, fill in the gap for us, pending when we are going to have younger ones, coming on board to help us in the healthcare system. So I think it's a good one from the government, and I think Nigerians will benefit from the experience of elderly doctors, experience of those who have seen, who have gone to the forefront, they've seen, they've conquered, they've been able to see several cases, and they can give you spot-on diagnosis on any issue. So it's a lot of work from the government, and I think likely we all will benefit from it.
All right. I want to say thank you so much, Mr. Osundara Tope, for
Doctor.
joining us. Thank you, Dr. Tope. Thank you so much for joining us. We hope that the next time we'll speak with you, there would be a response from the federal government. Hopefully, positive response. Hopefully, it will be signed, and then you can proceed, because we truly need the healthcare workers. We don't want anything happening to anyone, especially at this time. Thank you so much for your time.
You're welcome, sir.